Welcome to the podcast Psychedelic Awakening, brought to you by Psilogen Biotech, where nature meets precision science. Hello, everyone, and welcome back to the podcast Psychedelic Awakenings. For anybody that is catching this first podcast, our goal really is to generate awareness about psychedelic therapies, the benefits, the challenges. And we focused our first few episodes on individuals who have benefited greatly from psychedelic therapies. Today, we're going to flip that on its head. We have a very special guest that Ryan is going to introduce in just a second that actually is performing and facilitating those therapies.
A few weeks ago, I decided to quit spending $7 a day on store-bought coffees, and instead, I start my mornings with something way more affordable and way better for my health. Let me show you how I start my mornings using Magic Mug by Mushroom Brain. I start out by steeping my loose tea. The Mystic Chai is my current favorite, but all of their teas are absolutely amazing. The chai blend contains chaga mushrooms, which are rich in antioxidants and help with overall well-being. I've definitely noticed a huge difference in my energy levels with no midday caffeine crash. I love sitting over it while it's brewing. It smells amazing. I would honestly drink these just for the health benefits, but they're so good, I wake up and crave them in the morning. Start your mornings right at mushroombrain.ca.
Yeah, so we'd like to welcome Alexis Goth. She's an MD CFPC and a mother of three. She's a hospitalist family physician with over 20 years of experience in primary care, hospital medicine, and integrative/functional medicine. She completed a fellowship in integrative medicine in 2015 through the University of Arizona. She's a certified functional medicine doctor under IFM, the Institute of Functional Medicine. And she's also an entrepreneur. She's the founder of Alchemy of the Seasons, which is a nature-based retreat program, as well as Hollows Integrative Health. And it's a multidisciplinary clinic in Bedford, Nova Scotia. They are a team trained in psilocybin, ketamine, and MDMA-assisted therapy, and they apply these medicines to help people in personal self-realization.
Now, this is the part where it gets interesting. Dr. Goth, why don't you share with us, you had a very transformative experience back in 2015 that led to a decision to change your career path and what you're doing and how you're helping people. Tell us about it.
Yeah, I did. Thank you so much. Thanks, Sean. Thanks, Ryan. Thanks so much for having me with you. Yeah, in leading up to 2015, in a nutshell, I was experiencing what I came to understand as complex chronic stress. And it was expressing for me in itself as daily headache, became really food sensitive, had colitis, essentially. I was having bloody bowel movements, a lot of dietary sensitivity, and significant full body pain. So this was happening probably 2009, 2010. And I began on a healing journey, got really into food as medicine, yoga, a lot of holistic care practices. So I was kind of in that space, really opening, really clearing, really detoxing. And then in 2015, I ended up taking LSD. And it was my third time taking LSD, but I certainly wasn't prepared for what was about to happen. And I thought I was dying. I thought that I was certain I was dying, actually. And I got to a place where I'm like, I guess this is it. I guess this is how I'm meant to die. So I just gave in because I was that certain I was dying. Of course, I wasn't dying. I didn't know anything about psychedelics at the time. And I had a total dissolution of my sense of reality, my sense of self. I had a massive heat in my pelvic area that rose through my body and split like a diamond out of my forehead. And I was shot into a state of bliss consciousness that lasted about 3 weeks. So afterwards, when I got home and I was trying to make sense of what happened, I understood it was a Kundalini awakening that was precipitated by the LSD. And I've spent really the last 10 years integrating that experience. It had such a monumental impact on, my entire sense of self, my entire sense of reality, my consensus into what I'd been told before that. So I really committed to offering spaces that might help people who are experiencing any number of things, but essentially any altered state of consciousness. And I can help them stabilize that consciousness.
It's a really amazing experience.
Yeah.
Psychedelics are something that have been talked about for a really, really long time. Dating all the way back to the 1900s. You mentioned that you've been kind of on this journey for the last 10 years or so. I'd love to learn a little bit more about what you've seen as an evolution over those 10 years from, maybe a practitioner's approach of it being accepted, and then kind of project out into the future. What do you think the next 10 years might look like?
Yeah, that's an awesome question. I would say like there's been organized study, as we know, in the late 50s and 60s on psychedelics, specifically at that time, a lot of LSD research and its benefit for addiction and depression. And then we know that research was really shut down because of concerns with safety and really probably some concerns around maybe the expanded states that were happening. And before that, though, we know collectively and culturally, entheogens and plant-based medicine has been used maybe for tens of thousands of years and not been studied by our scientific systems. I think we're at a place now where we can notice that these medicines, I mean, they really are self-revealing, right? That is what psychedelics are. They're self-realizing and self-revealing. So based on my experience, but also based on what I'm noticing in clients, I can genuinely say I don't think that there's a medical intervention that can even approximate the power of a psychedelic experience. There's nothing that can come. Near-death experience, I put there.
Right.
Honestly, near-death experience and maybe an out-of-body experience, but it's that cataclysmic. It's that capacity by which you can see things differently. There's really nothing that comes close. So even though we're using it in this mental health realm, kind of, it really is for all human experience and how that might be feeding into your own personal belief, your belief of self, how you organize yourself, the choices you make for yourself. So I feel like if we projected that into the next 10 years, I mean, the potential is profound. We look back into use in the past, we believe like in the Ulysses schools and the mystery schools.
Oh yeah, the Eleusinian mysteries.
Right, the Eleusinian
Yep.
mysteries. So if we think back, like what kind of social magnitude of change is possible, that in the mystery schools, in the birthplace of our entire organized sense of democracy, probably came out of working with entheogens and groups.
Incredible. And so now let's just pull this back to Canada and our healthcare system right now for a second. And obviously, right now you're working, treating people that have a significant need and can't be helped with other medicines currently or other treatments through the Canadian Special Access Program. Can you tell us just a little bit about that process?
The example of mushrooms or psilocybin. So it's still considered a regulated and a Schedule III medicine. So it's not legal access. But through the Special Access Program, you can access legal access mushroom. Now, this is a Health Canada program, and it's not a program specific to psychedelics. It's for any controlled substance that is not readily available, typically research chemicals, research pharmaceuticals. It is a pathway that we use, but it's proven to be a challenging pathway, and the criteria are very strict. It's accessible for refractory major depressive disorder, meaning that they've had clients that have had depression, that they've tried multiple modalities, multiple pharmaceuticals, and they've not been successful. It can be passed for end-of-life distress and palliative situations. And there has been some access for chronic pain, but our direct experience has been it's quite challenging to get people approved.
Through that process, are they typically being approved for just psilocybin or just MDMA, or is there a case to be made for like a polypharmacy where there may be a therapy where you're using either both together or in conjunction with one another?
Right. So we had an application in recently we've asked for both MDMA and psilocybin. It was rejected, I think, on the basis that we asked for both. We reapplied and asked for just mushroom, and it was passed. So I think they're not at the stage where they're keen to offer two at once. And actually, we've had limited success even getting one medicine approved. So we learned from that, and we're just trying to get one medicine approved at a time.
I see. Okay.
Can you paint a picture of being in room with people that are experiencing and going through these challenges and now using psychedelics? Paint a picture of sort of the ideal candidate, that makes sense for.
Yeah, sure. And at the beginning, I mean, we can talk about different health conditions, but typically a lot of the people that we're seeing, they're coming in with a mental health condition or experience or diagnosis. And often that could be someone with major depressive disorder. They have been depressed for a long time. They've been tried on different psychotherapy. They've been tried on different antidepressants. And while they may have had some movement, they habitually just feel like nothing has really brought them out of that stuck kind of contracted state. Ideally, the people, I think that they have an optimal outcome is they're curious, they're open, they're receptive to change. They want to change. They're very open to the possibility, which also means that their neural networks want to open. They're naturally curious. They're feeling engaged. And again, ideally, they have a sense of community. They have some connection around them, and they have a sense of safety in either their housing or their finances. Like those people are probably probably going to do the best. People that are isolated, that don't have a strong sense of community, I mean, that's a challenge. That's a real challenge for their mental health. So we recognize that. We do try to build community, around them. But that's when I noticed the people that have that kind of coming in tend to do really well with those factors.
So when you have a patient that is approved and let's say it's a similar client profile to kind of what you just described, how is the efficacy of these treatments being measured, as it is still something that's still limited in access? As we try to build a bigger body of evidence, it's going to be really important to make sure that we're measuring those treatment markers. And I'm just curious to know a little bit more about what those might be.
Yeah, that's a great question. So when we make the application for SAP for psilocybin or MDMA, we use some objective tools. So the GAD-7 would be a self-reporting scale for anxiety, and then we have the PHQ-9, which is another self-reporting scale for depression. We would repeat that self-report after the session. And now, for example, if it's through the SAP, we're given 3 doses. So there can be 3 dosing sessions in sequence. And it's not always clear, like, when do we get those objective markers? Now, some people can have a really transformative experience after 1 dose of a medicine. And others, like we see with ketamine, we also work with ketamine, which is legal access. We notice that typically over a series of doses. But right now, it's mostly self-reporting scales.
And Alexis, can you explain what is the role that the psychotherapy plays alongside the psychedelics throughout the therapy session?
We ensure that all the people that we're working with have a supporting therapist, because what's really going to happen with the psychedelic is they're going to be shown aspects of themselves, maybe things that have been in their subconscious space or what we call in their shadow space. They're not really engaging with this material. It could be just emotional material that they've never processed, they've never engaged with. Purposely, the psychedelic will pull that up into your conscious attention so you can begin working with it. So the psychotherapy and the counseling around it is really an essential ingredient to help you engage with your own experience. Often it's childhood experiences that adults have not really had a conscious awareness of. So in our clinic, one of the other physicians is trained in internal family systems, IFS. It gives a beautiful framework for how to begin noticing yourself, the parts of yourself, so you can work in compassion with yourself. And we notice that combination, the IFS with the psychedelic, can be really, really profitable for people.
Awesome. And I've noticed you kind of talking a little bit throughout this process about how psychedelics may be able to benefit people beyond just like a PTSD diagnosis or something along those lines. Can you maybe talk a little bit more about your personal experience with that and how you've been able to integrate some of those things into your life and how that may have gone beyond just a clinical diagnosis of something?
So I think there's a separation between mind and body, typically in medicine, and culturally, most people don't necessarily think of their body when they're thinking about mental health. But, with enough self-reflection, you realize that clearly your head and your mind is attached to your body and you're having one continuous experience in body. So all mental health experiences, whether it's anxiety, trauma, dysregulation, fear, worry, panic, pain, and depression, are all physiological, body-based, encased in your body experiences. And most of them are related to all your other systems, specifically your gut, the microbes in your bowel, how well your body is receiving and working with nutrients, your sleep, your social engagement, your connectivity. So even though we open the door, people might open the door with psychedelic because they might be having an emotional or quote unquote mental health experience. There's actually no such thing as just a mental experience. You're having an embodied physiological experience that has been categorized just belonging to mind. We also can argue that all physiological experiences and all disease states have within them ways in which we engage. Now, whether that's with fear or worry or anxiety, maybe it is related to trauma or trespassing of boundaries or lack of self-love. We don't think of those things as being precursors for physical disease, but they're all impacting your physical disease experience. So in my experience, I had severe stress being expressed in my body, but it wasn't until I had to look at my own sense of self and my own, not enoughness, or that I had to kind of do more or be more. I had to crack into that level of the lack of self-love before I could actually translate what was happening in my shoulder pain, right? And then we're learning this. People have to really get into why they're doing the things they are. It might be expressed in your leg, might be expressed in your gut. Most of the time, it's unprocessed, unresolved, honestly, belief structures that are set up at a very young age.
Yeah, I would agree with that. I would, from my own experience, absolutely agree with that. Now, for somebody that is looking at exploring this as an option, can you give us a little bit of the pathway that somebody might take And the second part of the question is how would that person know that the psychedelics that are being acquired are safe?
Right. That's a great question. And so I'll just say, so in our clinic, we work with ketamine, MDMA, and mushroom. And we sometimes try to pair what we think the best molecule or the best medicine would be for the client. But there is also a truth that all roads lead to Rome. So you can have what begins to be converging experiences regardless of what molecule you're working with. Ketamine, because it is legal access, because we don't have to get through any hoops at a Health Canada level, is, I would say, the easiest to work with. And in many cases, for many people, can sometimes be the best choice because of the background, the reliability. It's a regulated pharmaceutical. It's very safe. Some people would rather work with mushroom. Mushroom, again, is probably one of the most safest, if not maybe the safest medicine that's ever been studied. It's incredibly safe. The barrier, again, would be the Health Canada barrier. And then even if we do get access from Health Canada, it is an extracted psilocybin product. It's not whole mushroom, and people might have a conflict that they don't want to work with the extraction. They'd rather work with whole mushroom. If that's the case, we do have what we call a harm reduction model where we recognize that they're going to choose to use raw mushroom, and we're simply going to offer them an integrative, holistic, safe, trauma-informed support system as they choose to work with whole mushroom. The same can be said for MDMA, right? There's MDMA that we can get from Health Canada. It's very expensive. Sometimes that price is very limiting. And so people will have a harm reduction that they will find what they believe to be a good source of MDMA. We can't, of course, directly refer them to that or prescribe that, but we can offer them this safe container so that they themselves can have a safe experience.
So it's interesting that you talk about the safe container. As we kind of see things expand in the psychedelic industry as a whole, places like BC decriminalizing access for small quantity possession. What's your opinion on the free or open use of psychedelics versus using it in a therapeutic environment? Is there maybe, do you think it poses a risk? Is it, maybe a good thing that they're opening up access because of what you mentioned, them being so safe? The physiological harm of these drugs is pretty minimal. So, what's your opinion on that model in BC, and how do you think that is impacting people's experiences?
Okay. Well, and it's curious. I think the pilot in BC, while it legalized small possession for like heroin, DMA, fentanyl, cocaine, crack, and meth, psilocybin was not included. If I'm not mistaken, maybe that's changed in that grouping. So of all the things you could have on you,
right,
that's the very thing. A small volume of mushroom is probably the absolute safest, especially because it's a small dose. But that pilot is up in JIT. Right? Yeah. It's like local, except for this, everything else I have on me. But that pilot is being revised in January of 2026. So we'll see what happens. But to your point, and I should rephrase maybe what I'm saying. Psilocybin is a great example. It's incredibly, there's no toxic limit, right, to actually ingesting mushroom. You can ingest a large amount of psilocybin, and it's extremely physiologically safe. Now, we all have ways in which we witness reality, and that way is fairly rigid, and that default mode network in our brain is giving us service because it's closing in all the information that we could otherwise become aware of. Large psychedelic doses, by definition, override your default mode network. They take down the boundaries, the barriers by which we perceive, and we can have extremely expansive states of consciousness. Those can be, and typically are, pretty destabilizing, right? When you're not used to thinking that way. It's also why they work. So system disruption of the set rigid ways in which we witness is typically keeping us ill and keeping us from accessing wellness and from healing. Right. So opening up the rigidity is actually why psychedelics are very valuable. When we open up, though, the limited way in which we witness and we're ill-supported or unsupported, it can be total disruption. And it kind of happened to me. I'm kind of glad it happened to me so I can know what that felt like and not have community and not have support when that destabilization happens. So we really do believe that in a clinical setting with trained professionals and people that they've experienced non-ordinary states of consciousness themselves, they can feel into what it's like when you end up in one yourself and offer really grounded, practical, 3D support versus someone maybe going off on their own, maybe having a state which is really dysregulating. Not to mention there is the risk of persistent, like a perceptual psychosis, which can happen. Now, I would argue that a psychotic state is a non-ordinary state that's ungrounded. It's when people do not have the right tools or frames of reference to really hold their consciousness. But nobody wants to be put in that situation where they really lose touch. They're it can generate tremendous amount of fear and lack of safety.
So this is something that truly you're very personally passionate about and based on your own experiences. Can you give us a couple of examples of things that really surprised you or things that were like kind of aha moments as you've gone through this process, juxtaposed to treating somebody with traditional medicines, or we call
Right.
not traditional, but Western medicines?
Right, for sure. And just for reference, I was an atheist. I was a total materialist. I did not believe in any of this. I didn't believe in a spiritual domain. I didn't believe in God. Like I really, really was a materialist. So I kind of loved this was my story. And now there's nothing I don't believe in. I think the way that we're set up in medicine is, again, we've dissociated the body from the mind. We have not had an integrative approach to what we recognize is really going on. And because we've not been taught this, we don't know what we don't know. I didn't know that my emotional lack of exploration was connected to my gut dysfunction. I didn't know that because I hadn't processed my childhood trauma that I was having skin reactivity. It was so separate. And it took me having this experience to really have this convergence of information and recognize, oh my gosh, I'm having a spiritual mind-body experience in one experience. There is no separation. And it took psychedelics for me to bring those polarities together and actually recognize that they're together. Our medical model still separates them. Everything that we've been told separates them. And so many people still, my clients, when I meet them, like, I'm anxious and I'm depressed. Oh, and I've got this body pain, but they're not connecting that maybe their anxiety and their body pain is one experience. And until we have something that can bring us into that awareness, it's very, very hard to heal because it's like we're looking at the puzzle from multiple spaces, but we're not actually ever connecting it. So psychedelics encourage and allow for an actual connection that you can have your aha moment of like, wow, okay, the trauma that I received from this, but you can just begin seeing it and it's all self-realizing. You can recognize that your own experience is causing these experiences that are typically in the physicality by now. And then you can move towards whatever healing that is. But until you make that connection yourself, you can listen to all the gurus in the world and you can do the self-talk and people can tell you it, but until you experience it, it's really, really hard to heal.
The integrated approach that you take and that kind of holistic view is really wholesome. And I appreciate you sharing that with us. It's very inspiring what you're doing. And thank you for taking the lead in an industry here in Canada that's really burgeoning. I think we've got great things coming in the future and we'd love to hear more from you.
Thanks so much, Ryan.
Thank you for joining us. A wonderful experience to have this conversation, and we'll talk again.
Thank you. Thanks for having me.